An Australian study monitoring patients with a variety of different viruses. Illness for all three infections showed time-dependent decreases in symptoms. So we went from 35% down to 27, 12, and 9% after 1.4, 3, 6, 12 months respectively. And by 6 months, 11% were found to have symptoms, right? So again, there is a time factor, and people are impatient. And I'll tell you what, I'm a bad sick person. If I'm sick, I hate it. I don't like having any reason not to be able to go, full force, 18 hours a day, and all that sort of thing. But there is a time to just be patient and say, listen, this knocked me on my butt, and maybe it's a wake-up call for me to take better care of myself. But having said that, some patience to let myself heal. You can't just flip a switch or snap your fingers and everything's fine. So specific to long COVID, a meta-analysis of 15 studies, the subjects were comprised mainly of patients who were hospitalized for acute COVID-19. 80% at 100 days after infection, 80% reported one or more long-term symptoms, 58% fatigue, 44% headache, 27% with attention or concentration limitations, 25% hair loss, and 24% shortness of breath. And of course, these are symptoms normally reported sometimes with people who don't take very good care of themselves. So I would say, at least at this point in time, all of the long COVID patients we've seen have had pre-existing conditions that, if you address them, sped the process of healing, and often resolved much of this. Longitudinal prospective study of adults with lab-confirmed SARS-CoV-2 infection followed up for 9 months, a high proportion with mild disease, 30% reported persistent symptoms, and fatigue was the most common symptom. And by the way, I used to talk to people every day before COVID about people being tired. People ask me all the time, I'm 66 years old, you are always so energetic. Well, my diet, my lifestyle, everything about the way I take care of myself facilitates operating a human being at high energy all day long, which people were not doing before COVID. During the lockdowns and everything else, I think everybody's habits got significantly worse. And so it was just the perfect scenario for people to get sick and be sicker than they normally would have been. Prospective study of 50 lab positive and 50 lab negative patients. Authors note lack of antibody detection despite evidence of active infection has been demonstrated with other viruses, including hepatitis C. Some long COVID patients previously infected but with symptoms were seronegative. So again, the testing is very faulty. And again, you see the same thing here. Let's go on to the next slide. The authors wrote that the increased female to male ratio and comorbidities suggest autoimmune etiology of long COVID. There does seem to be some of that. And then instead of considering it exotica, we've worked with autoimmune patients for years and years, and we treat them as an autoimmune patient, right? And many of them were trending toward autoimmune before COVID, and then it appears that sent them over the edge, one of the reasons being that their immune system went into overdrive to try to fight the infection, which triggered the already brewing autoimmune disease, right? So pre-morbid depression, anxiety prevalent in 42%, versus 21.4% of all adults suggest a possible neuropsychiatric vulnerability to developing long COVID. The authors also suggest that constellation of symptoms, especially fatigue and cognitive dysfunction, resembles chronic fatigue. So one thing, this whole idea of who has long COVID, what is it? It's a moving target. It's anything you say it is. There are a couple of studies I want to show you that indicate that we are just calling everything long COVID right now. So this particular study looked at 300 adolescents who definitely had COVID-19 with 85 controls who definitely didn't. And there was follow-up for 6 months, and the primary endpoint was post-COVID conditions. The COVID group, 48.5%. The no-COVID group claimed the same symptoms, 47.1%, where there's no difference, right? The secondary endpoint was fatigue. The COVID group, 14%, the no-COVID group, 8.2%, not statistically significant. Now, please don't misread what I'm saying. If you say you're tired, I believe you. The point is why. We have to figure out why. And as long as you blame it on everything on long COVID, And then you have these people out there saying, take my 6 supplements and long COVID goes away. You're never going to fix this problem. You're just going to exacerbate it. And that's so often what happens in the healthcare space is people think they have something, they go out and look for easy solutions, and they spend a lot of money before they get to us. Very often they've spent a lot of money. Having or not having COVID made no difference in this cohort. What did make a difference is female sex and psychosocial traits such as neuroticism and emotional maladjustment. And so it's not so much that it's in your head. The point is that what's in your head is not productive, and you have to fix that in order to be a healthy person. So the idea of people having persistent symptoms and that sort of thing, that are related to their mindset is not new. And in a different section of this conference, I was involved in a panel discussion, and Steve asked me about, what happens when people come to you and they change their diet and they do all these things? What can people expect? And I said, well, it's highly variable, because first of all, people are in different conditions when they show up. But the other thing is their mindsets are different. And there's a great book I've recommended a lot called The Expectation Effect. And I just want to show you how clear expectation is in health. The first story in the book involved a guy who was diagnosed with cancer. And he recovered. And then his doctor told him bad news, it recurred, and I don't even see you lasting until Christmas. He made it till New Year's and died. And on autopsy, they found out that he didn't die of cancer. There was no cancer in his body. He died of expectation. And so to get well, you have to want to be well, right? And we can't help people become healthy who aren't interested in becoming healthy. So what we're dealing with here is psychosocial traits that have to be addressed. And so again, everything getting lumped in with long COVID. A review of studies, Vinay Prasad was one of the researchers that published this. He's a phenomenal researcher, by the way. We don't agree on everything, but I find his perspective refreshing because he just calls things like they are. They looked at 80, he and his researcher partner looked at 83 studies. They found 3 randomized controlled trials. Most of the rest were observational. And the problem is serious limitations in the studies. They lack control groups. They don't control for confounders. There's no standard definition, and some studies show clear bias. So again, you just have this soupy mess of everybody claiming long COVID. Do some people have symptoms associated with having the flu and difficulty to recover? Yeah, figuring out what's what is important. And there is a lot of money right now in calling everything long COVID and prescribing magical solutions for it. So what I'm going to do now is I'm going to go through and we're going to look at the various symptoms that present as long COVID. We're just going to call it that for now. And then what you do about it, because that's the real issue. I don't care what label you put on it. All right, so we know that the spike protein has a particular affinity for the ACE2 receptors, which means it's going to affect the cardiovascular system. And so if you have damage to the endothelial tissue that lines the blood vessels, you're going to have a lower production of nitric oxide, a vasodilator, and impaired vasodilation results. And then, of course, think about the high-fat diet with all that thick, sludgy blood that it creates, and the dehydrated patient with thicker, sludgier blood trying to move blood through shrunken blood vessels with less nitric oxide being produced. All right, so basically what you do with this is you get people hydrated and prescribe a plant-based diet, a low-fat plant-based diet. And eventually the endothelial tissue starts to come back to life and nitric oxide production increases and hydration plumps up the blood plasma, and you don't have the thick sludgy blood trying to make its way through narrowed vessels. And then this is a really interesting study that I use because it just goes to, no matter how healthy you are, there's healthier to get if you aspire to be, but it just goes to what I'm talking about. So endothelial progenitor cells are made by the bone marrow, and then they're converted to endothelial cells that line the blood vessels. These are the ones that produce the nitric oxide. This very interesting study in Okinawa, they had 45 healthy young women randomized to either continue their current diet or to get some extra servings of Okinawan vegetables every day for 2 weeks, all right? So both groups had folic acid levels increase and homocysteine levels decrease, but the change was statistically significant in the women who ate the extra vegetables. And circulating endothelial progenitor cells increased in the group eating the extra vegetables. And so my point is that if you can make incredibly healthy people, like the Okinawan women who routinely live to be over 100 years old, if you could make them healthier doing this, think about the effect that you will have on people who are unhealthy, who agree to, they don't have to eat Okinawan vegetables, they just have to lower the fat, increase the fiber, and really load up on the plant food as opposed to what their diet looked like before. Autophagy is the body's cellular recycling system. It's involved in programmed cell death and eliminating pathogens, and it's like the quality control system for the body, taking out the trash, as it were. Over time, parts of cells become defective or stop working, and the cell breaks down and discards old tissues, and you recycle the stuff that's usable, and then autophagy cleans house. So it keeps cells functioning properly and optimizes performance. Immune dysfunction resulting from SARS-CoV-2 or any other infection can reduce autophagy. So as autophagy is reduced, inflammation levels increase. Dysfunctional monocytes secrete pro-inflammatory cytokines, which increases inflammation even more. And this can begin to have a negative effect on taste and smell. This is some of how taste and smell were damaged during COVID. So disruption in autophagy can cause mitochondrial dysfunction. Fatigue is a hallmark symptom of mitochondrial dysfunction. Disruption in autophagy results in accumulation of dysfunctional mitochondria and can lead to severe cardiomyopathies. And also mitochondrial dysfunction is also a hallmark of cancer as well. So good reasons to pay attention to this. Disruption in autophagy can also cause microvascular damage and endothelial dysfunction. So again, an endothelial dysfunction can cause all kinds of problems, ranging from shortness of breath to postural orthostatic tachycardia syndrome. So what you want to do is encourage autophagy, and if you can, detoxify the spike protein. So one of the incorrect claims circulating out there is that autophagy requires intermittent fasting, like eating within a window every day, and or a low carbohydrate diet. And that is not true. First of all, the low carbohydrate diet's an insane proposition. Some people are talking about keto diets for this. All right, so you already have endothelial tissue damage. You have lower production of nitric oxide. You have significantly increased risk of coronary artery disease. And now you're going to eat a high-fat diet? There is a place for a keto diet, but this is truly insanity at its extreme. And the other thing is that I have never understood why we want to make this harder than it needs to be. There is zero evidence that eating within a window improves any marker of health as compared to just eating well and taking care of yourself, right? So autophagy can be improved with good habits. I'm going to show you that right now. We'll come back to medically supervised water fasting, which does promote autophagy, distinctly different from trying to eat between 8 and 4 every day, which I don't want to do, and I'm pretty motivated about health. And then we'll talk about some different supplements that may play a role, not by themselves. This whole idea, you go online and buy a 6-pack of supplements and fix all these problems I'm talking about, it's fantastical thinking. All right, so exercise and sleep, shocking, right? I mean, again, the low-hanging fruit, the deer outside the window, not the zebra, that's where we want to go to fix this problem. So exercise induces autophagy in organs involved in metabolic regulation, such as muscle, and then in the liver and the pancreas and the fat tissue. Treadmill exercise was shown to induce autophagy in animals. Getting the right amount of sleep triggers autophagy. And by the way, the right amount of sleep, even that is so misrepresented. We have people out there saying all adults need 7 hours of sleep. Great book. I can't remember the name of it right now, but we talked about it in our Healthy Book Club a few years ago. It was written by the guy who set up the Mayo Clinic's sleep clinic before they started drugging everybody. And one of the things that he outlines in the book is the evidence for varying sleep patterns in adult humans. Like some people are short sleepers, medium sleepers, and long sleepers. So the right amount of quality sleep varies from person to person. I happen to be a short sleeper, and the longer you try to get me to sleep, the groggier I am. Wake up a long sleeper in the time that I sleep, and the person will crawl around on the floor all day. So that's a very individualized thing, but there's no question that sound sleep and enough of it induces autophagy every single day without any other party tricks or supplements or whatever.